Welcome to Penrose Learning, where we make understanding easy.
You begin by confirming which ultrasonic tip is right and which is left. This matters for blade orientation and visibility. Once confirmed, seat the tip into the handpiece until it clicks and make sure the locking sleeve engages. You should set the unit power low, then gradually increase. This prevents chatter and heat. Also confirm water flow and tip rotation. If you hear vibration or see excessive deflection, stop and reseat the tip before proceeding. Small corrections avoid larger problems. You position the active face of the right or left tip against the target surface, adapting at a shallow angle so power is transferred laterally, not apically. Once in contact, use short, controlled sweeping motions along the line angles. Keep strokes parallel to the surface. Make sure you maintain continuous irrigation to flush debris and cool the tip. If access is limited, change to the mirror or modify angulation rather than increasing pressure. Doing so preserves tip integrity and reduces patient discomfort. You finish by gently probing and visually inspecting treated areas to confirm deposits are removed and surfaces are smooth. Once done, purge the water lines, wipe the tip, and visually inspect for microfractures. Replace the tip if any damage exists. If you encounter excessive vibration, noise, or loss of efficiency, stop immediately, reduce power, reseat the tip, check coupling, and exchange inserts if necessary. This troubleshooting step prevents patient harm and extends equipment life, so follow it every time.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.